Hello everyone, my name is Marielle Hammond and I am a member of the Duke DPT Rehab to Performance group here on campus. Today I'm interviewing Dr. Shefali Christopher, who is an athletic trainer and also a graduate of the Duke DPT program in 2008. She is a sports physical therapist who specializes in the endurance and triathlon trained athletes.
Yep.
Thank you for letting me interview you today.
Sure.
So when you are working with a patient, how do you look at their movement?
So I think movement is the key of what we do.
Right.
So when someone comes in, I first look kind of globally at how they're moving. How do they walk in? If we look at big movements, how do they squat?
Right.
Then I, break it down like our funnel. Look at their smaller stuff, their little pieces of like range of motion and things like that, and flexibility. And then I go back to more of a screen to see if there are other parts of other pieces of the puzzle that are contributing to the injury. So that's when I would pull out sort of an SFMA or
Right.
something like that to say, okay, well, I've looked at kind of grossly what this hip is doing, but is there something in the neck and the shoulder that may be contributing to this?
Okay,
So,
great. How is movement integrated into your philosophy?
like I said earlier, movement is the primary focus of my physical therapy interventions. I think that's where PTs fail. They just look at the little impairments, but it's taking that patient from where they've got their full range of motion back, where they've got their flexibility, to how they get back on the bike. How would they look on the bike? Because what you may do on the table may look very different when they're actually moving. And so it's a huge part of what I do, and I try not to let the patient leave the clinic till they've shown me that they've reintegrated back into their sport
Right.
correctly. I think that's where both PTs and patients fail. Once you're feeling better and you can run and you think, oh, I'm running fine, you go ahead and do it, versus what does that look like?
Right.
Are you still doing something that you're going to come back again for the same injury? Or have we been able to correct that?
Right.
So I think movement is it should be the key philosophy to anyone's practice,
Right.
especially with the active athlete.
Okay,
So
great. When you're training or rehabbing a patient, what are some of your philosophies or methods?
okay, so I have tried adding as many tools as I can to my toolbox, because I think diversifying your skills
Okay.
is important, because every patient is very different.
Right.
So right from, I have my dry needling certification, I have my Grasson certification. I do a lot of manual therapy courses. I just try to have a variety of tools, so that if you need a spanner or a wrench, you have it all.
Right.
Because just when you think this patient's going to present, IT band, it's going to have this, this, and this, they're going to come in and have an unstable fibula, and that's what's causing their distal IT band pain, and you just get stumped.
Right.
So I think, and also part of my philosophy is walking into, the patient and just using my clinical reasoning skills,
Right.
not saying, this should be this, should be this, because we know that sometimes things don't follow the way they should.
Absolutely
and
not.
so you just have to keep an open mind and treat the impairments and focus on the movement. So.
Okay. And then also under that kind of same category, how do you deal with, movement differences between men and women in the clinic?
Yeah.
As well
So,
as
especially with
issues.
my population, the endurance athletes, the men tend to be tighter,
Okay.
and the women tend to be too flexible or too weak.
Okay.
And so those are the big gross things. But just like as we discussed earlier, I mean, if you try to stretch me right now, I'm really tight.
Right.
I'm not the flexible kind.
Neither am I.
But especially after having a baby or two, that I'm still tight in the wrong places and weak in the wrong places.
Right.
So I think it's hard to generalize.
Okay.
Because you'd think a male would come in with tight hamstrings and they don't have it, and their calves are doing all the work or something. So I think it's hard to generalize, but in general, that's what I'm seeing: the tighter and the weaker.
Gotcha. And I know now that you are starting to move towards specializing in postpartum women and retraining them after having children. Can you elaborate more on that?
Yeah, so what I've just been seeing is even 3 or 4 years down the line, people have returned to running quickly because of the ease of sport. You know,
Right.
you have a baby, and a few months later, you are ready to, you're itching to get out, and you've got that brand new jogging stroller, so you're pushing the baby. But what happened to the core that got overstretched?
Right.
And what happened to your body that's wasn't as active for
Right.
9 months of it,
Right.
even if you ran through your pregnancy, there were a couple of weeks
Right.
where you didn't do anything just because you had a baby. And we all know that a week of not doing anything, you lose strength. And so I always describe it to my patients like this is like playing Mario Brothers. You just drop down a level, and sometimes you get so low and you can't just jump to the next level. You have to work through jumping on the stars and collecting your pennies or whatever the stuff is. So
Sure.
so I even forget the question. But yeah, so with my postpartum women, I'm just seeing that they've rushed too fast
Okay.
and they've done too much. And I'm trying to figure out a way where we can intervene sooner than later and make
Okay.
the strength a better part of their program early on, so that 3 years down the line,
Right.
when they're coming back after the second child, they're not
Okay.
derailed. I'm actually starting a PhD soon,
Oh, great.
and that's going to probably be my question.
Okay.
If home exercise intervention given early on to this population can improve their running function.
Great. And is that during pregnancy, or are you just working with them strictly after they have their
So
child?
I have had a couple of patients during pregnancy, especially if they've had, they don't come in just because they're pregnant.
Right.
They come in if they have some
Back
issues
pain.
like a back pain or a diastasis that
See.
was already present in with their second child,
Right.
or different things, SI instability. So I'm seeing more of the pregnant athlete that's injured.
Okay.
I would love to see the pregnant athlete who wants to just stay healthy.
Right.
But we don't see much of
Okay.
that. So.
Okay. Great. Knowing that you love to work with endurance-trained athletes, what are some challenges you face with integrating a strength training program for those patients that are also participating in a high-mileage training?
Yeah, so that's a
program?
really good question, because a lot of people have their plans laid out,
Right.
and they've done it for years, and they
Right.
know what works. But I always sell it as strength is power, right?
Okay.
You and I both want to get faster. And so if I can say, just give me a chance, I'm going to bring you back from this injury stronger and faster, they're more likely to trust you and believe in you a little bit, right? Also, they're in there for a reason.
Right.
They've been injured for a reason. So if I can show them how their mileage is actually maybe not helping them but hurting them,
Okay.
that's a big one. I think with runners, they just, again, we come back to movement, right? So they're moving incorrectly.
Okay.
So if I can show them through strengthening how they can move correctly, just integrating some functional strengthening into their program, they're more likely to do it. And I
Right.
always kind of break it up into, do these exercises before you run, do these right after you run.
Right.
So it's part of their routine, not part like, oh God, now I have to give up a run to do
Some strength.
some strength.
Okay.
But a lot of coaches and programs now are incorporating a strength day, which is great. It's a complete, change in how people are thinking. So that's exciting.
Great. And I know that you had mentioned power, and I know a lot of the strength training for endurance-trained athletes would probably be, on the side of more of an injury prevention and also trying to gain a little bit of power for their running. Would you be able to specify, I know it's different for every person, but, sets, reps, like that kinds of things, for that power-trained
Yeah,
athlete?
so I think, again, we think of endurance athletes and we give them a lot of 3 sets of 20.
Right.
But I think just like we would with our strength athletes, you've got that linebacker who's
Okay.
pushing the sled.
Right.
He needs to explode. So why can't my cyclist explode? Maybe you have to keep all in perspective and parameters, but I often mix it up. They'll have one day where they'll do endurance stuff. So
Right.
are their glutes doing 3 sets of 20?
Right.
Are they doing 1 set of 50 clamshells before they start running, just to kind of feel that glute med kick on and
Okay.
stabilize them? So it's very different, but yeah, I definitely incorporate the power aspect into all my athletes.
Okay, excellent. Thank you. And then the last question, what are 2 or 3 things that you think healthcare practitioners should be doing that they are not?
So I think we don't learn enough about movement in our curriculums.
Okay.
I think we learn very, very quickly, look at the squat, look at the walking, but what we don't learn is, what does running gait look like? What does biking gait look like? What does throwing motion look like? What does it break down to?
Right.
And I think that's the movement piece that's missing.
Okay.
So if we can look at screens or things like that can quickly tell us how people are moving, I think we're failing not incorporating that into our practice. Early on I would, check range of motion, weakness, check all the impairments that I know to check, and then as they improved, they have full range of motion, they have no more tightness, I would let them go back.
Right.
But then they'd be right back in my clinic because they were moving incorrectly. And so I think that the movement piece is a very, very important one, and I think physical therapists are not doing a good enough job with that. And I think also, like I mentioned earlier, as patients start feeling better, they self-discharge. Okay. So it would be unfair for me to say physical therapists are doing not a good job, okay. But at the same time, teaching that to the patients so they don't just stop coming because they're feeling better. Okay. If hey, I can run 10 miles, why should I go back and pay a $70 copay to see my physical therapist? Well, because you don't want to come back again. Right. And now we're so close to the end, we should just clean it up and finish it up. Yeah. Okay. Some of the other, I think some of the other things that people are doing is, like I mentioned earlier, a very cookie cutter approach. If it's plantar fasciitis, we should treat it like this. Right. And just from every patient is different, everyone moves differently, and so really looking at your patient and figuring out what is unique to them.
Individualized program.
Exactly. And I think lastly, people keep it very global, especially with my population. I've seen that you have to keep it a little bit more simple. So you can show them a one-leg squat, but can they even activate that glute med inside lying with a leg raise? Can they even do it correctly without using their quad too much? Do they know how to lift their leg without using their back? So I think that, early on I would give them, lunging on a Swiss ball, to the side and all this other fancy stuff. But if you can't control the minutia, you're not going to be able to control the global movement, and you're going to compensate. And sometimes when you're a young therapist, you can't see those compensations as quickly. And so I think keeping it simple is a really important thing, and putting your hands on the muscle you want to activate, really feeling for what you're trying to do, feeling for things that shouldn't be moving that should be moving. Are they lifting their arm and using the upper trap? They may be looking like they're not using the upper trap, but if you palpate it, is it actually activating into you? So I think that's where I've over the years learned, I need to keep it a little bit more simple, not boring, that's different, but keep the movement simple so you're not throwing too much at them. But eventually you will do that. Right. But early on, just getting them to move correctly is a very important thing.
Great. So, well, I really appreciate it. Thank you so much for letting me interview you.
Thank you, Mariel.
Bye.